Hi, my name is Tristan, and I'm going to be accessing a mediport today. It is Wednesday, January 23rd, about 10:20 in the morning. So the first thing that I'm going to do is introduce myself to the patient, explain the procedure. They've probably had this done before, considering that they have a port that's already in place. And then I'm going to do some hand hygiene. I'm going to check my patient identifiers that I have the right patient, and compare it with the chart. And then I'm going to put on some clean gloves. And the patient already has a mask on. I put their mask on before we started the procedure, just because this procedure with the mediport, it's really close to the heart, so we want to avoid trying to get any extra things in there that could cause infection. So the first thing I'm going to do is just kind of palpate where the port is, so I have a good idea of it, and I can feel it right there really well in the chest, so I know where I'm working from. So I'll take off these clean gloves, do a little more hand hygiene. Hand hygiene is important. And then now we're going to get started with the procedure. So I have my sterile central line dressing change tray right here. And so I'm going to open that away from me. And the patient has their mask on, so now it's time for me to put my mask on. And be careful if you have glasses, because your glasses will fog. And I have my sterile gloves here. And before I put my sterile gloves on, I'm going to put this needle in here. This is the needle I'm going to access with. Just be very careful. Putting that in there. And now I'm going to put my sterile gloves on. So now the next thing that we're going to do is we're going to cleanse the area. So I have a ChlorPrep in here, and you just crack it, and then you go side to side and up and down vigorously, making sure to get the whole area cleaned, about 2 to 4 inches around the site. And then we get rid of that. So the next thing that I'm going to do is I'm going to actually access the port. So the first thing I want to do is take my needle and the little thing off the end, and I'm going to attach my normal saline syringe to it, just so it's easier that we've got that attached already. Okay, so now we're ready to access. So now this hand becomes non-sterile, and I'm gonna hold here, and then I'm gonna let the patient know we're gonna insert at a 90-degree angle. And then once that's in, we need to aspirate for blood. And then if I get blood return, it means we're in a good spot. And so I need to flush with 10 mils of normal saline, which for this mannequin I won't, but I would flush with 10 mils of this, and then I would switch and I have a heparin syringe in here, helps it from not clotting off, and then I would flush with the 5 mils of heparin, and then put this little cap back on, and it's a special cap to where it has chlorhexidine in it, so it helps with like infection. not getting infection in the wine. So then the next thing that we do is we put on the dressing. And this Tegaderm will come in your kit. So make sure that your Tegaderm, you can see all of your port when you put your Tegaderm on. And then for other nurses that are going to be here, it's important that you date, time, and initial this little piece of paper that comes on your Tegaderm so that they know when it was accessed. And just put it on the side there. So we're done with that procedure, so we can take off our sterile gloves and wash our hands. And then now I've told the patient, hey, it's time to remove your port, you're gonna go home. So just put on some clean gloves. And so this is not a sterile procedure, so I'm gonna first take off the Tegaderm. So just kind of start from the edge and work your way around. This is not fun for the patient. That off of there. And then we have to take another Chlorpep and just cleanse the site up and down, horizontal, vigorously. Get rid of that. And then we can go ahead and you just want to pull the needle out at 90 degrees straight out and then dispose of it. Actually, before we would pull the needle out, say the needle's still in, we want to make sure that we are in the right spots. So I haven't pulled the needle out, just cleaned. Take this little cap off the end and then make sure you clean it good. And then just like we did in the beginning when we accessed, make sure you aspirate for blood and then flush with 10 mils of normal saline. And then flush with 10 mils of heparin and make sure you clamp off. And then we're ready to de-access. So straight out into the sharps container and then document.